Okay, so we looked at the amniotic fluid. We looked at what conditions that are actually wrong to the amniotic fluid. So we looked at oligohydramnios. Here we are looking at polyhydramnios. So if you say something is oligo and the amniotic fluid is less, poly is like what? The amniotic fluid is so much. Do you understand? So polyhydramnios just have to do with what? It's a condition during pregnancy where there's too much amniotic fluid. Amniotic fluid is too much. This fluid surrounding the baby is too much, So while cases are often harmless, like most cases harmless. Why? Because the baby needs like this. It needs it so that it can be able to swim freely, grow, but if it is restricted, that's when you have all those intrauterine growth restriction. You understand? So most cases are harmless, but if it is so much, it can lead to complications for the baby and also for the mother. You understand? So what is polyhydramnios? It's when you do an amniotic fluid index and it's more than 24%, or the deepest vertical pocket is more than 8 centimeters. So it occurs in about 1 to 2% of pregnancies, most commonly dictated in the second half of pregnancy, but can appear as early as 16 weeks. Okay, so you can see so much. One of the complications is almost the mother's stomach will be too tight. You understand? So causes sometimes is unknown. Sometimes it could be that the mother has diabetes. The mother has diabetes. Sometimes it could be that the baby is developing abnormally. So it could be that you have problems in the digestive tract or the central nervous system. The baby has some inability to swallow amniotic fluid. All right, twin to twin what syndrome. We've spoken about that. Fetal anemia. The baby has anemia. It could be that there's rhesus factor incompatibility. The baby is rhesus positive, the mother is rhesus negative. So the immune system of the mother seems to be fighting the baby. So you can have a lot of amniotic fluid, due to maybe breakdown of tissues, release of fluid, Could be infections, toxoplasmosis, cytomegalovirus infections. Alright, so that's just it. So symptoms. It's often asymptomatic in many cases. Alright. But in moderate to severe cases, so the mother's stomach is getting so big, alright, the mother is struggling to breathe, abdominal discomfort or tightness, the mother's legs are swelling so much, difficulties feeling fetal position, the baby has so much fluid that you can't even palpate it, uterine contractions or preterm labor. So diagnosis is fundal height be larger than expected, ultrasound to measure this amniotic fluid index or maximum vertical pocket, fetal monitoring to assess the well-being. Right. So treatment and management is mild cases, often without intervention. Moderate to severe cases, you treat any underlying cause, you control maternal diabetes, amnio reduction, you are draining excessive fluid through amniocentesis. Then endometacin, frequent monitoring. Then early delivery, if you know that complications will basically arise. So that's a beautiful story behind polyhydramnios.